it's possibly that it's misinformation out there about that. Um, One of the things I'm hearing is you're being there's a microchip that's being injected into you through the vaccine. Now, let's talk about that.
Okay, listen, I'm not laughing in a demeaning or condescending way. I'm laughing because, as a scientist and health advocate that I am, it always amazes me how these unbelievable rumors can get started and they become very widely believed in the lay population. Listen, the mRNA has nothing to do with the microchip. I've gotten the vaccine, by the way. I'm fully vaccinated. If anyone knows anything about microchips and how you implant microchips, you wouldn't implant it the same way you give a vaccine through a shot like that. It's just not true. I understand that people are concerned. Let me address the bigger issue rather than kind of parse out all of these kind of somewhat extreme and a little wild conspiracy theories. Let me just say this. I understand people have doubts about the vaccine. This vaccine rollout and the whole treatment of COVID was bungled horribly from the very beginning. The Trump administration did an absolutely horrific job of alerting the country about COVID and of dealing with the vaccine and getting it rolled out. So it's understandable that a large swath of people are nervous and suspicious of the vaccine. I can't change what's done in the past. I come to you with no agenda. I'm just a physician, health advocate who just wants everyone to be healthy and to live. So I have no interest in vaccines or political or the pharmaceutical companies. But I will tell you this, that these vaccines are good vaccines. And let me give you this comparison, by the way. Normally, when we create vaccines, if a vaccine is 60% effective, the medical community would say, that is a good vaccine. We would be clapping for it. I'm telling you that Pfizer and Moderna are 94 and 95%, that J&J is 65, 72%. Those are great numbers. But because people are so concerned and worried and they've been so misled, they don't understand how good these vaccines are when you look at them in full context. Number two, I understand the history of the government and African Americans and research and Tuskegee and Mississippi. I understand all these historical reference points to how African American and those who've been impoverished have been unfairly treated and targeted and practiced upon by researchers and the government. I get it. That being said, this is a situation where you got to kind of use some common sense. You have former presidents, current presidents, you have people like myself, you have black, white, rich, poor, professors all getting the vaccine. There is no way for there to be a system where a certain batch of vaccine is contaminated and shipped only to a certain zip code and then only distributed to certain clinics to affect African Americans. I mean, in order to accomplish that, you'd have to have one of the greatest, undercover spy, execution networks ever in history. It just is not the case. That being said, there are people who should probably not get the vaccine, or let me say, there are people who should talk to their doctors if they should get the vaccine. If you're pregnant, if you have an autoimmune disorder, maybe cancer, immune system problem, you should talk to your doctor. Blood clotting issues, talk to your doctor in conference to make sure that it is okay for you to get the vaccine. And you make that decision in concert with your doctor. So I will say that. But let me also say, before I end this part of it, that percentage of people is very small. It's a very small number of people that really need to have that conversation. The vast majority of us can safely take the vaccine. A lot of people have side effects. Okay, that does not mean you have COVID. And it's usually after the second shot. I say usually. Once again, nothing is guaranteed in COVID. Usually after the second shot, you may have some side effects, pain at the injection site, muscle aches, weakness, fatigue, hot flashes, cold chills, headaches. These things happen. It doesn't mean you have COVID. It's your immune system getting kicked into gear, which is what the vaccine is supposed to do. The immune system is getting the vaccine is getting your immune system kicked into gear so that in the event you actually see the real virus, your immune system now knows how to prepare its soldiers to go out and fight. And so don't let the side effects stop you. You have to get both shots, and they typically go away after 36 hours, 48 hours at the most.
Okay. So now we're going to open it up for Q&A. Anyone